Our project is titled The Development and Expansion of Protocol for Preliminary Assessment Data Collection in a Multicultural and Multilingual Preschool Setting. So our purpose was to streamline and create a uniform evaluation procedure for culturally and linguistically diverse population, also known as CALD, which is an acronym you will see throughout this presentation. So our purpose was to create this protocol, including dynamic assessment techniques, best practices, ethnographic interviewing, and additional considerations that clinicians need to consider and be cognizant of when completing evaluations and working with this population. And while collecting research for this project, there is definitely a difference between evidence-based practices and what is currently accessible and being implemented across the U.S. So our background information shared with us that SLPs should use CALD sensitive assessment materials out of respect to these students and their families to best capture their communication abilities. We are primarily working with the Arlett Child Development Center in Cincinnati, which houses preschoolers ages 3 to 5 years old from many CALD backgrounds. Every semester, UC graduate clinicians complete a clinical practicum at Arlett, and before they begin, they complete a series of training modules to prepare them for working at the site. The purpose of our project was to better prepare UC graduate students coming into Arlett and working with these CALD students and teaching them techniques and strategies on what these students need to know.
Okay, so under the methods section, we have kind of just identified the steps that we have completed and will be continuing to complete as our capstone project will continue throughout the summer semester. So our initial step was to identify any areas needing improvement throughout this process at specifically Arlett. And that included meeting with our supervisor, who identified a need for flexible but formatted learning module for the undergraduate students and the graduate students who are there for their placements. So that would be utilized during a universal screening process, identification and assessment of the children at the school. The second step was a literature review. During this step, we collected and thoroughly read various articles revolving around this population, as well as English language learners in school-based settings. It also included familial communication, language analyses, and more, which we'll discuss later in this presentation. Third, it was a resource compilation that included things like ethnographic interviewing tools and just things that we could put into a learning module for those same students who are going to be your undergraduate or your graduate students to use. Fourth, and where we are now, is the creation of this poster and then the presentation of this poster at Praise. And that'll happen, of course, in the future, but the poster is finished. Tomorrow, March 28th, we're going to Arlett to see the site. We were hoping to do that a little bit earlier, but things changed, and that's where we're going. So we will update the project as we go throughout the summer with some information gathered tomorrow. Next, we'll develop some additional tools to put into the module. So this might be presentations for the module. It might be an ethnographic interview, checklist, et cetera, and that'll develop as we go on. Seventh will be the overall organization of that information into a learning module format. And eighth, finally, would be to provide our findings and our collection of materials to Arlet.
So for the participants in this project, we obviously are hoping to create this checklist and this module for graduate student clinicians who are working at Arlet with culturally and linguistically diverse students. So that would include speech-language pathologists and then clinical supervisors at Arlet. And we also are hoping to interview some parents or caregivers, or maybe create a survey that will allow them to give input into what they want to see assessed in their children, or how they would like clinicians to work with their children or to view their children. And we also want to collect some input and collaborate with the classroom teachers at Arlet so we can see what areas we can better observe and better assess in culturally and linguistically diverse students. And then obviously the main population as it stands of people that we're looking at is the preschool CALD population ages 3 to 5, because that's what Arlet currently serves.
All right, so one thing that we've mentioned a good amount in this presentation thus far is ethnographic interviewing. And just to kind of go through a brief discussion of ethnographic interviewing, it is a way of interviewing individuals, in this case parents of the children, that allows them to give you the information rather than us to ask for a directed information. It's just a little bit more open-ended. So some principles to use in this parent interview is going to be using open-ended questions. So a lot of statements or questions that are stated as, tell me about, et cetera, et cetera. Maybe tell me about a typical day for your child. Next, we would restate the caregiver-client report without interpretation or paraphrasing, which shows that we're actively listening to their concerns. Then we would summarize and allow the client or caregiver to give corrections, which helps to avoid any kind of misinterpretation or just confusion throughout the team. And then we would want to avoid any why questions. We'd also want to avoid any leading questions, which would be something that would promote unnecessary bias in the interview. And we're really looking to gain information about the child in a holistic way. So we don't want to give those leading questions. And then finally, we're going to be asking one question at a time, which gives the parent time to elaborate and answer the questions honestly, and then focus on the specific information that is being asked of them. That benefits the child, that benefits everybody involved, really, just to have as much information in as holistic of a setting as possible.
So up at the top, you'll just see a brief outline of materials that we want to include, make sure we are including in our module for these UC grad students. First, we'll start with assessments. Here, we will offer options for standardized CALD assessments that these graduate clinicians can pull from that are available at Arlet. So we'll list informal assessments, standardized assessments, screening tools, and parent rating scales that can all be used when working with this population to get the best picture of the child. We'll also talk about dynamic assessment procedures and testing considerations that should be taken into account when you're testing this population. We'll also talk about test, teach, retest. Further down, we'll talk about language sampling, which is a really big tool for getting a full picture on a client's abilities beyond what a standardized assessment can tell you. So we'll talk about a few different ways that language samples can easily be collected. We have the sugar language sampling technique, and we also have the assessment 360 technique, which are currently used at Arlet right now. We'll also talk about securing interpreters, how you can find those resources when you are on your own or working at Arlet. And finally, we'll also talk about parent communication and ethnographic interviewing. We'll talk about principles for ethnographic interviewing, questions to consider, and finally, we'll include that parent questionnaire or things that you should be curious about as a clinician when you are working with this population.
Okay, so like Emma briefly mentioned, one of the things that we're going to be talking about is Assessment 360. And this is a way to provide, or this is a framework that provides a comprehensive clinical guide for assessing English language learners. And they use an acronym called GRASP-IT. So in this box, really small in the corner, is the circle that they use, which just shows an arrow pointing to each one. So we're going to start by gathering information. We're then going to review it. The step is ask, then see, proceed, integrate, and then test. So one of the main bases for this is that by 2030, 40% of all US school-age students will learn a minority home language and English as a second language at school. And that was a statistic that we found from the US Department of Education. So this tool, which we'll discuss further, is just a way of, again, creating that comprehensive guide for when to assess and when we get to the formal assessment process with kids.
And then that second option for language sampling is called the sugar language sampling technique. This is a fast, free language sampling technique that can take about 30 minutes from start to finish, from collection all the way through analyzing the sample. This technique was based on what current SLPs in the school setting, their opinions and methods for collecting language samples, and this approach interviewed them and took their concerns about validity of the samples that they were collecting and addressed them and improved the methods, and that's how they made the sugar language sampling. So to collect a language sample with this method, you just need 50 utterances. And on their website, they have a wide variety of resources that can teach clinicians this sampling method for free, which we will be including in the module. There is a free video course that teaches you from start to finish how to implement and score this technique. And there are also normed analysis pages based on ages ranging from 3 to 7 years and 11 months. They also have intervention ideas for parts of grammar within language sampling and additional resources to really best implement this method and learn about language sampling. And all of that will be included in our educational module.
Hey, Emma, I'm sorry, can you go back to Assessment 360? Thanks.
Yeah.
So to dive a little bit deeper into the GRASP-IT acronym, so I just wanted to kind of give a more specific overview of this. So the G for gather is the step where we're going to gather all the necessary info. We're then going to review it. So we're going to examine what we find and determine what else is needed. Ask includes a step where we're going to interview people in this child's life. So the teachers, the family, any community members that can provide significant information to us. We're then going to see that step, the S is C. So we're going to observe the student in multiple settings with different partners that are just going to be a little bit more of a, okay, if they have the skills in a small group setting, can they carry them over into a large group setting? What does that look like for this child? Proceed, the P is proceed, which is kind of our next step. Do we have all the info we need? Does a student need any additional support for English language development? And is it appropriate to refer this student for a comprehensive evaluation? The I is to integrate. So we're going to analyze the data again, what we have. And did we provide cultural due diligence? Did we really assess this child in their culture? And do we know what their culture looks like well enough to say that, we haven't overlooked anything? And then the test as well is going to be the formal and informal assessments that we do. And again, like I mentioned previously, this is so important because there's so many English language learners in schools now, and it just aims to provide those students who may have potential speech language impairments with comprehensive, complete, and accurate assessment that does not contain or contains as little as possible bias. And this stems from a place of concern for over and underrepresentation of individuals from CALD populations who are identified as having a specific language impairment. So it's a really great tool for us to use, especially in this setting, to make sure that we're being appropriate, we're not using or we're limiting implicit biases, and making sure that these students can get the services that they need.
So currently results are preliminary in nature. So we've compiled a fair amount of our protocol to start with, including the Assessment 360 approach and the sugar language sampling protocol in our protocol. And so before we did all that, obviously we've mentioned that we did a literature review, which I'll show at the bottom here in a couple minutes. And that helped us to gather relevant data and information that we could use in order to create an effective protocol and something that's research-based. We have included some available CALD sensitive assessments in our protocol. So these are things that are formal assessments that can be used or that have been normed or have subtests that are normed toward the assessment of CALD populations. And we've also included some informal and dynamic assessment procedures, as well as, like I mentioned, the sugar language sampling and just overall guidelines for language sampling procedures. In terms of conclusions, so we see that there's a pretty big gap between what the research says and clinical practice. Although, like a lot of SLPs are trying to do these things in their practice, there are still a lot of SLPs who don't really, or who don't think about ways to properly assess CALD students. And we feel that grad students and SLPs need more resources and assessment materials in order to complete these dynamic assessments with this population, because the truth is, even though some people might be wanting to try these, they're not always available. And we also feel that parent opinion has to be at the focus of the evaluation. So viewing the family as a whole and viewing the family within the context of their own culture is really important when assessing the child. And so we really need to focus our assessment on the child as well as the family that surrounds them. And in terms of our project, we aim to add more CALD sensitive assessments, informal screening procedures, and we also want to add information on accessing interpreters, because this is a huge one when it comes to especially formal assessments, or really any kind of assessment with a student who might not yet speak English or who doesn't speak English at all. It can be a really useful tool and an important tool in assessing children and interviewing their families. And we also are going to add a more complete parent interview questionnaire. So things that we've kind of talked about already with the ethnographic interviewing, but kind of make it more concrete and easier for the graduate student clinician to really dive in and ask the appropriate questions to families. And lastly, I just want to mention our limitations. Obviously, with any kind of study, there are things that limit the accuracy of things or limit how far you can go in terms of creating the final product. So although we want to interview and survey parents at Arlet, it may be difficult, especially now that we're getting toward the later part of the year, to actually interview and survey them. It's also a very busy time of the year. So obviously parent availability and responses to our questions might be a limitation in kind of looking at what parents would like to see with the assessment of their children. We're also limited to the population of Arlet Preschool. So this doesn't, this is one preschool, this isn't all preschools, but we're trying to make this a more effective protocol for any sort of preschool environment that's looking to assess and adequately approach and respect families and children who are culturally and linguistically diverse. And we are also limited by the fact that these populations are not homogenous. There's continually changing cultures and populations evolving everywhere. And so the needs of those populations could change in the future. The populations themselves could change in the future. And so this is kind of like a here and now. This is based on the research that we have found and based on the present need. And then lastly, at the bottom, we have a list of references. So some of these we use to kind of provide a strong foundation for the protocol and the research that we've undertaken. And some of them are more like, so we rated these, we assessed the levels of evidence in each of these studies. And so some of them are more randomized controlled, and then other ones are more like guidelines or tutorials or kind of lower levels of evidence, but that are still really valuable to kind of viewing this and to creating our protocol. So if you guys don't have anything else to say, I just want to go ahead and thank you for watching our presentation, and we look forward to presenting at Praise.
Thank you.